Story 1. Being kept alive by machines in a hospital bed but having zero quality of life. My living will says that if I am ever in this situation, treat it as do not resuscitate and remove me from all life support. Story 2. Somehow waking up during surgery. From what I have heard, it is so painful and severe that it led to someone committing suicide 2 weeks after the surgery was performed. Phantom pain is no joke. Story 3. I was having regular treatments that required anesthesia and muscle relaxant in that order. One time, the muscle relaxant took effect before the anesthesia, and I was unable to breathe or communicate that I couldn't breathe. I am terrified that this could happen again. Story 4. I am a hypochondriac and I constantly think every little symptom I have is some horrible disease. Story 5. Cancer. Ironically, stressing about cancer will contribute to its development. I am trying to accept that I will likely get cancer, and my goal is to delay my initial diagnosis as long as possible. Story 6. I already have borderline personality disorder and bipolar disorder. I have been clean from anything harmful to myself for over 2 years. I have not had an episode in over a year and several months. I fear my next episode could be my last. Story 7. The one I am living in. Being epileptic is worse than you think. This illness has taken my independence, my freedom, and my stability. I can have a seizure at any time with no warnings and no way to avoid it. I can be asleep and die from a seizure. I take 11 pills a day just to control it, but once or twice a month I still have a seizure. This is not living, this is the bare minimum. Story 8. That something terrible will happen or I will die suddenly because my doctor refuses to believe anything is wrong with me. Story 9. Finding out I have terminal cancer that could have been prevented if our medical system supported more preventive care. Story 10. I have inherited the dementia that my father and his father passed away with. I am really hoping it is attached to the Y chromosome, which would mean I am safe. Story 11. Losing mobility and mental ability and being forced to rely on others for care is frightening. I am a highly independent person, which is a result of trauma, and I was recently diagnosed with lupus. I refuse to accept that my life will change, but honestly, the exhaustion and brain fog are so severe some days that I can barely understand how to cook a meal, do basic chores, or remember the routines at my job, much less have the energy for these tasks. I am only 28, and I am very scared about how life will be as I get older. Story 12. My fatigue keeps getting worse, and I become completely unable to function. That would be very difficult. Story 13. Added situational fear. Becoming extremely wealthy and successful, then almost immediately discovering I have terminal cancer. Well, crap. Story 14. I will get cancer. I smoked cigarettes for 45 years before I quit in 2021. Cancer runs in my family. My mother had a mastectomy for breast cancer. My father died from stomach cancer. His father died from cancer too, and his brother had prostate cancer. I am next in line. I am really praying that it skips a generation. Story 15. My intrauterine device failed, and I became pregnant while living in Texas. I then experienced severe complications and died because the doctors could not save me due to the abortion laws. Story 16. I am worried that my brain aneurysm will burst. I do not like this wait and monitor approach. However, I cannot afford the surgery or take time off. Story 17. I have had uterine cancer in the past, which makes a hysterectomy a matter of when, not if. I had some minor surgery for this issue previously and had a bad reaction to it, so I am not looking forward to the recovery from the removal of an entire organ. Story 18. Getting more boils. Mine always have methicillin-resistant Staphylococcus aureus, and it is the absolute worst. I luckily have not gotten a bad one since I was a kid, but it was still scarring. Story 19. Being locked in with a tracheostomy and percutaneous endoscopic gastrostomy, having no quality of life or independence, and being kept alive while my mental faculties are fully intact. Story 20. Living the rest of my life without being diagnosed for whatever chronic gastrointestinal condition I have. I have been dealing with it for almost 2 decades, and I have had no luck. Story 21. I get a lot of essential tremors. It kind of makes me worry that one day I will develop Alzheimer's disease. Also, kidney stones, I know they are inevitable. That does not make them any less terrifying. Story 22, Death. But luckily, when I went to get a medical marijuana card about 15 years ago in California, the doctor refused to provide it. He said I had high blood pressure and needed to get it checked. Then he said he would fill the prescription. I did, and he did. Now, marijuana is legal, and my high blood pressure is under control. Marijuana saved my life. Story 23, Cancer. I lost 3 of 4 grandparents in the last decade and an uncle who was in his 40s. I am constantly worried that I will find out I have terminal cancer before I see my sons grow up. Story 24. Every time something is wrong, the doctors just say it is your autoimmune problems. I am afraid they will miss cancer or something serious because they trivialize everything as just my autoimmune problems. Story 25. I inherited half of my genes from my father when it comes to medical history. My mother and her family tend to live to 90 and usually have simple medical problems. However, my father, his brother, and his mother all had retinal detachments, cataracts, basal cell carcinomas, and various stage 3 cancers before the age of 60. I am 43, so I suppose we will know more in 10 to 15 years. Story 26. Becoming conscious during surgery is a rare but serious issue. There is no way to communicate that you are not unconscious. This occurs in 1 in 500 cases where general anesthetic is used, which is too frequent for my comfort. Local anesthetic is often used, and patients typically do not experience pain. However, there are still sounds and smells that patients do not want to experience. Understandably, people report post-traumatic stress disorder when this happens. Story 27. Cryptic pregnancy is a condition where a woman is unaware of her pregnancy until very late or until childbirth. It can be distressing to discover the pregnancy too late to consider abortion, resulting in the necessity to proceed with childbirth. Story 28. To be misdiagnosed and have had the issue fixed if I had been diagnosed correctly the first time, but now it is too late. Or to have cancer. Story 29. I have epilepsy, and in all my 29 years, I have never been alone when I have had a seizure. Potentially not having anyone there to help me terrifies me because I will not be able to call emergency services in time. Story 30. One time, while working in the intensive care unit, I cared for a woman with locked-in syndrome. Because she could not blink, we had to put special glasses on her to protect her eyes. Despite this, her left eye became dry and infected, and I had to assist as a surgeon sewed her eyelids shut. Her sisters refused to discuss hospice or palliative care, keeping her alive in this condition for over 2 years. She cycled between nursing homes and the emergency room, returning to the intensive care unit every month or so with bed sores and pneumonia. It was heartbreaking. Locked-in syndrome is a rare neurological disorder that results in complete paralysis of voluntary muscles, except for those controlling vertical eye movements and blinking. People with locked-in syndrome are fully conscious and cognitively intact but cannot speak or move. They typically communicate through eye movements or assistive technologies. Locked-in syndrome is usually caused by damage to the brainstem, particularly the pons, often due to a stroke, traumatic brain injury, or certain diseases. There are different forms of locked-in syndrome, including classical, incomplete, and total immobility, which vary in the degree of movement retained. Story 31. I'm not sure how common it is, but I have heard that some people remain conscious and aware during surgery, as in feel everything as it is happening. No, thank you. Story 32. Dying from painful cancer while medical staff in the hospital try to save on painkillers for those poor people. Oh yes, and postnatal care in my country. There is no way I am going through that again. Story 33. Getting a serious illness like cancer or dementia is not a quick event that my family could recover from financially. It would be a long and slow process that would drain us dry over the years, causing us to lose the cars, the house, and everything else, ultimately leading to death in agony and leaving my family in extreme poverty. Story 34. Living too long. I would be cool, God willing, to stay here until my 80s, maybe early 90s. But longer seems too long and freaks me out a little. Story 35. Traumatic brain injury or Alzheimer's disease. I watched my mother go through dementia caused by a traumatic brain injury. She lived 16 years as a shadow of her former self, and it was heartbreaking and very difficult. I do not want my children to have to experience the same struggle. Story 36. Trigeminal neuritis. I had an isolated episode of trigeminal neuralgia, and it felt like someone had poured acid into my face. Story 37. I'm too trusting of medical professionals. I would definitely be the angle of death if they had the inclination. Story 38. I fear I am going to die of something heart-related. I am only 20, but my heart is not in the best health. I just had to get an echocardiogram done and frequently have symptoms of a heart attack. My heart rate is very inconsistent and can drop very low or rise very high. I have been admitted to the emergency room nearly 5 times this year. The biggest fluctuations I have recorded range from 27 to 202 beats per minute. I really want to go out and enjoy summer, but I cannot because I do not know if I will be okay. I really wanted to hike, but I do not know if it will cause something worse. I just wish I could be normal again. Story 39. I am 3 days away from spine surgery. Took years and seemed like forever. I ended up with spinal stenosis of the lower spine and of the cervical spine. Last weekend, I lost control of my bladder. I told myself this is not a good sign, so I took myself to the emergency room. I had emergency surgery. I do not want to ever have to say goodbye to my children. Story 40. Not including dementia, I woke up mostly blind 3 years ago. Now, it is a waiting game of sorts. Story 41. Getting any type of dementia is something I want to avoid. I never want to treat my loved ones badly or hurt them in any way. I also do not want to remain in my body if my mind is gone. What would be the point? Story 42. Any prion or rabies infection. Rabies can be treated if discovered before symptoms occur, but prion cause inevitable degradation of the body that cannot be stopped if acquired, or worse, if there is a genetic predisposition. Story 43. I do not know if this counts or not, but what if I have some kind of mental condition that internally I am completely unaware of and have had my whole life? In my own mind, I am fully functional and think I am living a normal life, but in reality, I am a babbling idiot and I will never even know. Story 44. Cancer and developing dementia. I work with dementia patients and I truly hope I never experience that, for my children's sake. At least cancer is treatable but still scares me. Story 45. Being diagnosed with a condition that has limited understanding, specialists, or treatment is challenging. I am currently experiencing this with my dysautonomia, and it is devastating. Story 46. Childbirth is scary enough, but then your risk of developing cancer in the 5 years after birth increases. Like, come on. Story 47. Sudden cardiac death. No warning, no chance to get help, no opportunity to put your affairs in order. Just sudden death. Story 48. After having a difficult experience with an eye surgeon, I have decided not to have any more eye surgeries. If I ever need another one, I would rather go blind. I can cope with losing my sight, but I cannot handle the idea of someone cutting my eye again while I am awake, or the pain of recovery. It is not worth it. Honestly, the inner peace that came from making that decision has been very healing. Story 49. Dementia or other conditions that destroy the mind run in my family. I do not have much hope of a cure before it affects me. Story 50. Laser eye surgery would change my life, but I am scared I would go blind because it seems quite common and leads people to suicide. Story 51. I feel like I have already gone through so much in the past 18 months, so it is hard to imagine what my current fear is other than receiving a terminal diagnosis. Story 52. Parkinson's disease. I went through this with my father 17 years ago. Then my partner of 26 years was diagnosed with this disease in 2017, and I soon became a full-time caregiver until his death in January 2024. Story 53. I have a serious illness, but I may not notice because my baseline health is poor due to the chronic illnesses I already have. Story 54. I am afraid of catheters. The thought of something being inserted into my urethra frightens me. I would rather die, thank you very much. Please just take me out into the field and put me out of my misery. Story 55. Rabies is a common reason for wildlife rescue. Rabies is a deadly disease with a 100% mortality rate once symptoms appear. There is no cure at that stage. Story 56. Being a financial burden for the people who have to care for me. Cancer, Alzheimer's, dementia, or any condition where they have to pay to watch me deteriorate in my own body. Other than that, probably that catfish that swims up your urethra. Story 57. Having cancer with a poor prognosis and knowing how long I have left. I cannot imagine what a nightmare it is to constantly see the days tick down. Story 58. Botox. Trauma from it growing up. If I have to get it, I listen to music while they inject it and treat myself to lunch afterward. Story 59. Cancer is common in my family, and I have a deep fear that it will take my life. The type I fear most is ovarian cancer. Story 60. Colostomy bag, though as I have gotten older, it is less terrifying. I am single and out of the dating world. Story 61. I once heard a story about a woman who had an unbearable itch on her scalp caused by shingles, so severe that she scratched through to her brain. If I remember correctly, it was some kind of nerve damage, so not easy to fix at all. As someone who suffers from severe eczema and has actually contemplated suicide due to the itching, I'm much better now, don't worry. The thought of a nearly incurable itch is terrifying. I don't believe I can get shingles since I had the chickenpox vaccine as a baby, but I am going to be paranoid about it for the rest of my life. Also, I asked my sister this question, and her worst fear is waking up during surgery. Story 62. I have been incredibly healthy for 54 years, especially in the last 30. What challenges am I likely to face that could lead to decline? Story 63. I do not worry until it happens. I heard a saying that when you are healthy, you have 100 problems. When you are sick, you only have one. Story 64. I work in the emergency department, so I have seen some things. For me, 1. Gangrene. 2. Sexually transmitted diseases. Thankfully, I have enough sense not to hook up and have sex with everyone, but you can still get them anyway. Endocarditis. 4. Pulmonary embolism. 5. Gingivitis. Story 65. Amyotrophic lateral sclerosis, dementia, or Parkinson's disease are very sad ways to experience illness. I have never had major surgery requiring anesthesia, and I have a fear of receiving anesthesia and not waking up. Story 66. Realistically, falling is a serious concern. I am not elderly and still have a spring in my step, but as I get older, I am terrified of falling and severely injuring myself. I do not have any family nearby to help, other than my children, and my friends live quite far away. I would need someone to assist me with basic care if the injuries were severe. I have disability insurance, but it only provides limited support. I am afraid of losing my job and not being able to care for my children and pets. Story 67. Having to go to the hospital. I cannot afford to spend everything I have saved and more just for someone to tell me what I already know is wrong with me. I know what is wrong with me, and I just pray that it does not become more of a problem than it already is. Story 68. Oh, this is my time. I have an obsessive-compulsive thought loop that I am going to have a brain aneurysm at any moment. Literally, maybe right now, and drop dead face first with no chance of survival. This has been an ongoing fear for probably 10 or more years now. I don't have any family history or anything like that. I just feel like an artery in my brain is going to rupture at any moment. Story 69. Early onset Alzheimer's disease. Hemorrhaged esophageal varices. Having another seizure, but this time when I am alone on the 3rd floor. I realize the last one is relatively minor in comparison. Story 70. Spending the last years of my life in a nursing home, sitting in front of a television, drooling on myself all day. Story 71. I have had necrotizing fasciitis in my knee and septic shock. I never want to go through that again. I never want to be in a coma again or intubated again. It has been 7 years, and I have the worst post-traumatic stress disorder imaginable. Story 72. Amniotic fluid embolism. My totally healthy friend had one after giving birth and was on extracorporeal membrane oxygenation and intubated in the hospital for weeks. It is a rare condition that is not well understood and impossible to anticipate. I am 18 weeks pregnant with my third child and cannot stop thinking about it. Story 73. Not being believed and treated like a drug addict when I am simply mentally unwell while being sick at the same time. Oh wait. Story 74. Not the needles or surgeries, but waking up and realizing I have forgotten who I am. Losing memories feels like losing myself, and that terrifies me more than anything else. Story 75. Dying like my mother did, they were giving diagnosis after diagnosis. We still do not know what happened, possible Creutzfeldt-Jakob disease, almost like amyotrophic lateral sclerosis. She also died at the same age as her mother, 65. I am only 40 and feel like I have 25 years left. Story 76. I didn't know it until I got it. I have 4 major medical issues that run my life. I have borderline personality disorder, attention deficit hyperactivity disorder, Ehlers-Danlos syndrome, and severe asthma. I wouldn't wish this combination on anyone. I'm 27, and it feels like my life is already over. Borderline personality disorder and attention deficit hyperactivity disorder make it almost impossible to have relationships or hold jobs. Ehlers-Danlos syndrome is a genetic disorder where your body doesn't process collagen. That basically means you have many random symptoms, and it causes several other diseases, including postural orthostatic tachycardia syndrome, Raynaud's phenomenon, mast cell activation disorder, lack of hair growth, gut and hormone problems, and hypermobility. Because of it, I've had an ovarian torsion, which is when one of your ovaries slips over on itself, loses blood flow, and dies. I break bones very easily and live with chronic pain and fatigue. It honestly feels like your bones are sliding apart slowly and like your limbs are always on the verge of falling asleep. With all of this, I look normal. People don't think I'm sick because I don't look sick, so they never take me seriously. The amount of medical gaslighting has really broken me. I cry when I go to the general practitioner for a checkup, just from post-traumatic stress disorder. I wouldn't wish this on my worst enemy. Story 77. Cancer. I have been gaslit for over 30 years about my issues, including ones I am legitimately diagnosed with. I feel like when I have cancer symptoms, I will be ignored. I also see a lot of cancer cases at work. Story 78. As of now, it's my neck. 3 days ago, I convinced myself I had a swollen lymph node, so I poked, prodded, and squeezed it so much that it made my muscles puffy. Now, I am convinced I have thyroid cancer. In a few days, I will have another medical fear that consumes me. Fortunately, I keep these fears to myself, but I have believed I am dying for about 3 years now, despite having no evidence to support this thought. Story 79. My girlfriend's mother is in an assisted living center and has very limited mobility. It is sad that this will probably be the last place where she will live. Story 80. Any degenerative disease or mental illness, but having to undergo intense surgery without anesthesia is different. I saw a video of a woman sharing her story about how it was her culture's tradition to cut off younger girls' clitoris and labia. She was 3 years old when it happened. Story 81. Experiencing kidney stones, severe bladder conditions, or being diagnosed with diabetes can cause frequent urination. This is irritating because I want to go regularly and just be a normal person without having to urinate all the time. Story 82. Anesthesia awareness occurs when a patient is conscious during surgery, but unable to communicate that they are awake. Additionally, there is a rare risk of being exposed to fire during surgery, which can also be caused by anesthesia. Story 83. I was a hospice nurse for years, and the 3 most challenging illnesses for me were amyotrophic lateral sclerosis, pancreatic cancer, and dementia including Alzheimer's disease. Amyotrophic lateral sclerosis is a very difficult illness and way to go. Pancreatic cancer can take you down very quickly, often with very few symptoms. I had people mowing their grass and doing well, then gone a couple of weeks later. Dementia and Alzheimer's disease felt like a very long and heartbreaking goodbye. From those years, I learned a couple of things. We really don't know what is ahead of us, and we don't have control over much of anything. We might think we do, but that is an illusion. Keeps us sane, but in the big picture, things can change suddenly. Having said that, and having just finished a cancer battle myself for the 3rd time, I tell everyone. Seize the day. Story 84. As a person with type 1 diabetes, I have been losing access to insulin. I have been using insulin pens for the past decade, but I am finally considering switching to an insulin pump. My insurance keeps changing which insulin pens are covered, and I am afraid they will tell me that I do not actually need them. I have been hospitalized twice for diabetic ketoacidosis, once because I did not have any insulin pens available. I absolutely need them. Story 85. As someone who watches Grey's Anatomy and movies like Final Destination and Saw for fun, it is hard for me to fear anything related to death. Diseases and disorders are uncontrollable and happen to everyone every day. What I fear is doctors or nurses making a mistake so grave that it takes my life. My great-uncle died this way. He had cancer and was receiving treatments. He had many tubes connected to him, and the nurse pushed air into the wrong tube, causing him to die shortly after. Story 86. My wife is pregnant. I am white and she is black. Context is important. I have learned a great deal about the inequities in healthcare, especially concerning black women. I am afraid that the doctors or nurses will not listen to her when she explains what is happening. The black maternal death rate is noticeably high. I am afraid that I will lose both my wife and our baby. Story 87. Amyotrophic lateral sclerosis. I am a caregiver. I have taken care of many people to the end of their lives who had amyotrophic lateral sclerosis. It is always terrible. One specific client I had was a military veteran who ended up with cancer on top of it and could not feel anymore. The cancer ate a hole into his body so deep that I had to pack a pillow's worth of gauze into it every day. Story 88. For me to stay in bed without being able to move or speak, hearing everything is difficult. Alzheimer's disease and dementia are more challenging for those who live with the person. Story 89. My mother battled Parkinson's disease for 20 years. It is a horrifying disease. Her final 5 years were indescribable. I have been tested for the most common genes associated with Parkinson's disease and the results were negative, but the possibility is still very much present and terrifying. Story 90. Not being believed about pain or certain symptoms and ending up with terminal cancer or another horrible diagnosis that could have been avoided if only someone had listened. I would die kicking and screaming. Story 91. Recurrence of breast cancer. They removed one breast and some lymph nodes. I have pills to take for 5 years because I could not receive chemotherapy. If I still do not have cancer after 5 years, then it probably will not come back. Right now, I am told I have a 7 to 10% chance of developing metastatic breast cancer, which is incurable. However, if I last another 18 months, the chances decrease significantly, and I can stop taking the hormone blocker. Story 92. That they will just tell me to lose some weight or that it is anxiety when it is actually something really important. Story 93. Brain-eating parasites or something of that nature. There was a show called Monsters Inside Me, and it featured some of the most terrifying things ever. It scarred me for life. Edit. It is a true medical show, I believe. Story 94. My biggest fear is dementia or a stroke. My grandmother had dementia. My mother had a stroke in 2020. Her right side is partially paralyzed, and she can no longer speak. She wants to tell me many things, but she just cannot anymore. I visit her daily. She is still at home with my father and all the care I could arrange because I work full-time. The doctor said it would be better to take her to a care home. Today I went to see her. She did not hear me come in, and I saw her crying softly. My heart breaks every time I see her. Story 95. Having a serious condition and not being diagnosed until it is too late is common. I have heard many stories of doctors misdiagnosing serious illnesses as weight-related or anxiety, which later turned out to be stage 4 cancer. Story 96. Having a heart problem where they have no time to prepare you and have to just cut you open immediately. I have one side of my family that is riddled with every heart problem you can imagine. Car accident. Story 97. Being under anesthesia, unable to move but aware of everything, is not a good feeling at all. Not at all. Story 98. People will take my medical choices away from me again. This makes it hard to seek medical care at all. Story 99. I am mostly scared of getting a serious illness that disrupts my life, and there is not much I can do about it. Story 100. Aside from the standard answers one would expect, such as an extended episode of sleep apnea resulting in death by asphyxiation, that is just the average person's experience. However, for those who have Chiari malformation, it is a death sentence. There is no way to do anything about it, suffocating in your sleep and being physically incapable of changing it. Story 101. All of it. Literally all of it. I have very bad health anxiety, and once I start thinking I have a problem, it is very difficult to employ logic of any kind. I am always scared that I am having a heart problem, despite having it checked multiple times and being told I have a healthy heart. I once helped an armadillo out of the road, and occasionally I worry I caught leprosy. I went to the hospital a few months ago because I caught an antibiotic-resistant infection. The emergency room doctor thought I had a pulmonary embolism because of my chest pain, so now I have a new health anxiety fixation on whether this pain is a blood clot. Pain in the right side of my chest? That could be a blood clot in my lung. Pain in my leg? That could be a blood clot. I am worried I will be allergic to new medications. I developed an allergy to 2 different antibiotics within a short time, so now I fear I will never be able to take antibiotics. I get pain in my lower right abdomen, and I think I have appendicitis. I can go on for hours about the worries that go through my brain. Story 102. Living in pain or relying on someone to take care of me is not an option. I do not want anyone to take time out of their day to help me with basic needs like eating or using the bathroom. I do not like the feeling of owing others. I want to be the one helping. We need to do much more to support our elderly. We should stop charging people such high amounts of money. If everyone helped a little, it would not be so difficult for one person. Story 103. Alzheimer's disease, dementia, or a brain aneurysm. With everything that I have been through, I will have one of them for sure. My girlfriend tells me that she will take care of me no matter what. I do not know how true that is in reality, but I would rather be dropped off in the mountains and left to die if that is the case. Story 104. Somebody is going to slip me drugs secretly, and when I go to the hospital because I feel unwell, the doctors will not believe me. They will think I am a drug addict and ignore me. Story 105. Any neurodegenerative disease such as amyotrophic lateral sclerosis, Parkinson's disease, Huntington's disease, Alzheimer's disease, and others are all very serious and cause existential fear in me. Additionally, I have Parkinson's disease and Alzheimer's disease in my family history. Story 106. Sinus pyelonedalis. Had it once. Possible to reoccur. Worst pain in my life up to this point. I do not wish it on my worst enemy. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.